Public health experts in both northern Kentucky and Cincinnati say we are following a national trend here in the tri-state. The flu and several other viruses now at epidemic proportions. That also raises the risk for hospitalizations and deaths. So here's what you need to know to try and get the right treatment. When it comes to illness in our area,
just lots of viruses going around, several of them causing pneumonia. Viral pneumonia is very common right now.
So here's what you need to know. Viruses that cause colds and other illnesses tend to come on gradually and tend to have general respiratory symptoms. The flu tends to strike suddenly and usually includes respiratory symptoms, but also body aches and a high fever. It's hard at times to tell the difference, though, because both are
spreading around like wildfire right now.
To find out if you have the flu, you can get a quick check at your doctor's office or a walk-in clinic. If you do have the flu, an antiviral agent such as Tamiflu in the first few days may help shorten how long you are sick or may lessen the symptoms. If you don't have the flu, hydration and taking over-the-counter medications to ease a few aches is generally recommended. Hand washing and avoiding people who are sick is your best defense. If you get sick, however, you can lower the risk you'll cause harm to others by staying away from
babies under especially 6 months. Really, I guess especially babies under 3 months, because if they spike a fever, they're going to get a sepsis workup.
It is also better if you avoid visiting people in the hospital or at home if they are older and have compromised immunity due to breathing problems or heart conditions.
Grandma and Grandpa would have a hard time fighting these kind of viruses off.
I love Grandma and Grandpa. The real detail to pay attention to is just how long your symptoms last and whether or not they get worse instead of better. With a virus, you tend to feel better in about 3 days or so, 72 hours. The flu can last 7 to 10 days, and you need to seek medical treatment if you start to struggle with rapidly rising temperatures or breathing problems, especially if those show up in young children.